thing is this is an assessment as well as a therapy to help flexibility in the hips as well as thoracic spine and the adductors. And it's just a wonderfully choreographed routine that'll help clear up a lot of those areas. And the first thing I ask the patient to do, without telling them where I'm going with this, is a toe touch. So find their way to the floor, put their hands on the floor, and then I'll say animal style walk out into a plank. And I just observe their plank. Are they sagging? Did their shoulders hike up? Or are they in a good plank position? To me, that means that I'm on my toes, my knees are straight, my pelvis is in neutral, my lumbar spine is in neutral, my shoulders are depressed and active. So I'm actually externally rotating my hands into the ground. And I'll say to the patient, with my head in neutral, bring your right foot to the outside of your right hand. If they can't do it, if they wind up here, I already know they have tight hip flexors or lack of an ability to get there. So I want to see their foot right there. And I want to see this side, the left side, is stretching. Does that make sense? If they need to, if they have to have the knee to the ground, I'm okay with that. To get them started, that's fine. But I want them to really be in this position. And then we're going to bring right arm up to the ceiling to express the thoracic rotation. Do you notice what I did with my wrist? Extended it back like a Brugger's. I like looking at my hand to really bring my T-spine into rotation. Come back. Left hand up to the ceiling. Same thing. Really get them to fully express their range of motion in the chest. Back down. Plank. I ask them to widen their feet, walk back into a deep squat. I want to know, can they get into a deep squat comfortably? If they're up on their heels, what does that tell you as a muscle whisperer? It's really tight. Gastroc-soleus. And here's that adductor stretch and thoracic spine extension. So all of these are assessments for me. Are they like this? Can they even extend? And I'll show them, I'll tap their back. I know for myself, I need to extend through here. I'm probably in a little bit of flexion. So I've been working on that to get my hips nice and open and to extend as far back as I can here. You see what I'm doing with my prayer pose in my hands? Good. Left arm up, right arm up. Sink into the heels, connect to the glutes, come straight up. That was one rep. Feet back together. Find the floor. Walk out animal style. Plank pose. Left foot, outside left hand. Rotate as far back as I can go. Breathe. Hold it as long as you're comfortable. A couple breaths is good. Back. Rotation. Plank. If you want, you can throw in the push-up. Walk back as you separate the feet. Work on the adductor stretch. Extension, 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 extension. Extend, 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 extend. Arms up. Sink into the heels. Come straight up. It's good? Let's see what that feels like for you. I'll talk you through